According to the World Health Organization, a near miss is an incident that didn't reach the patient by chance or timely intervention, while an adverse effect is an actual error that may cause harm. So there's two scenarios in my case that both showcase the same um, importance of communication. In my hospital, I saw that a patient was transferred over due to hospital coverage reasons. They were at hospital A for about 10 days, intubated, and then transferred over to my hospital because their location didn't take the patient's insurance. When patients get transferred in, my hospital has a policy of a 4 eye skin assessment. The 4 eye skin assessment is performed by two nurses on admission, either from transfers or direct admissions, or even from intra hospital transfers. The nurses look for breakdown that existed prior to admission to my critical care unit. And during the assessment, the nurses discovered a deep tissue injury on the tongue from the endotracheal tube. The skin breakdown wasn't stated during the handoff report. During the second scenario, a patient was transferred from the same hospital from the telemetry unit to the critical care unit for increased shortness of breath that required an increased oxygen need. The patient needed emergent dialysis because they were fluid overloaded and they had stabilized by morning. In the morning, the doctor came to follow up on the patient's progress, and they asked about the patient's blood sugar. The nurse reported that the blood sugars were checked ACHS before meals and before bed, and the patient was transferred at 2 in the morning, so they hadn't done one, and one was coming up in about an hour. The doctor asked if the patient's hypoglycemic episode was no longer a problem. The nurse was not aware it was ever an issue because the patient was never on the D5 drip that the doctor mentioned, and the hypoglycemic episode was never announced to the nurse taking care of the patient. After checking the blood sugar, the nurse created a note about how the new information was never provided. And after writing the note and the STAR report, the nurse went back to the previous files. Apparently, the patient was transferred to 3 different floors in 1 day. So it was possible that the previous nurse who gave the handoff report to the ICU nurse never knew the information either, and it got lost in translation. It's also possible that because of the new onset of shortness of breath, the nurse who gave report didn't think it was important anymore because the shortness of breath was more important.